U.S. Vice President Mike Pence has visited a top U.S. hospital without wearing a mask, despite the medical center's own rules that visitors wear personal protective equipment. The number of coronavirus cases in the U.S. has exceeded 1 million, while more than 57,000 deaths so far. Meanwhile, the global coronavirus death toll has surpassed 218,000, with more than 955,000 people recovered. Good morning, I am Bipashna Tamang, and these are the headlines of the hour. Political crisis deepens as Premier Oli holds a crucial meeting with Executive Chairman Dahal. Party Secretariat meeting called for Thursday evening. 2 more cases of novel coronavirus emerged from Rohtak to take the COVID-19 tally in the country to 54. 38 active cases are as 16 cases register full recovery. Government efforts in controlling coronavirus are rendered ineffective due to the lingering confusion in special coronavirus committees and emergency centers. And number of coronavirus cases in the U.S. exceeds 1 million, with more than 57,000 deaths so far. U.S. Vice President Mike Pence visits a top U.S. hospital without wearing a mask. Prime Minister and NCP Chairman KP Sharma Oli held a one-on-one meeting with the Executive Chairman Pushpakamal Dahal earlier yesterday. We have a report.
The meeting between Prime Minister Oli and Executive Chairman Dahal has come at a time when the Dahal and Nepal camp was mounting pressure on Premier Oli to call Secretariat and Standing Committee meeting. The meeting, deemed as crucial on Tuesday morning between the two chairmen, had lasted some 2.5 hours. During the meeting, Prime Minister Oli reportedly said that he was not provided a suitable environment for his government to show its mettle. Chairman Dahal, on his part, complained about Prime Minister Oli's unilateral ways in operating the government. In response, Premier Oli said he was ready to mend his ways in the upcoming days and work as per party directive. However, Chairman Dahal reiterated that Premier Oli must face the Secretariat and the Standing Committee meeting to quell the rising grievances of the party members against Chairman Oli. The much-awaited Party Secretariat meeting has now been called for Thursday. The party General Secretary Bishnu Paudel has informed the Secretariat members that the meeting has been scheduled for 5 p.m. on Thursday evening.
The number of coronavirus cases in the country has climbed to 54 as 2 more people tested positive for the coronavirus yesterday. Speaking at the daily press briefing yesterday, spokesperson for the Health Ministry, Dr. Bikash Devkota, informed that 2 men in their mid-20s and 30s from Rohtak district tested positive for the coronavirus through PCR method. Spokesperson Devkota also informed that the 2 individuals had entered Nepal from India and had been in quarantine.
आज रौतहट जिल्लाका 24 वर्षीय र 35 वर्षीय 2 पुरुषहरूको स्वाब नमुना परीक्षण राष्ट्रिय जनस्वास्थ्य प्रयोगशालामा गर्दा पोजिटिभ आएको छ। उहाँहरू भारतबाट नेपाल आउनु भएको र क्वारेन्टाइनमा बस्नु भएको थियो। उहाँहरूलाई अस्पताल लगिदैछ। यसरी कुल संक्रमितको संख्या 54 पुगेको छ, जसमध्ये 16 जना निको भई घर फर्किएका हुनुहुन्छ भने हाल धनगढीमा 1, वीरगञ्जमा 3 र आज थप 2 जना आउने क्रममा हुनुहुन्छ। त्यसैगरी भरतपुरमा 1 र विराटनगरमा 31 गरी 39 जनाको उपचार भइरहेको छ।
Likewise, 54,826 swab samples have been tested in the country so far, including 10,807 through the PCR method and 44,019 through the RDT procedure. 1,193 new tests were carried out in the past 1 day. As for the provincial data, 4,828 samples have been tested so far in Province 1 through RDT, 5,249 in Province 2, 8,014 in Bagmati Province and 4,936 in Gandaki Province. Likewise, 5,328 samples have been tested in Province 5, 5,181 samples in Karnali Province, and the highest 12,283 in Sudur Paschim Province, which has been considered as the hotbed of the coronavirus, as thousands have flocked to the region from different nations, especially India, and the region has the highest number of active cases. 22,099 individuals are in quarantine across the country, and some 107 individuals are in isolation, 4 of them in the capital. 16 individuals have returned home after full recovery. The confusion seen in special corona committees and emergency centers formed by the government has rendered the efforts in controlling coronavirus ineffective. The notable absence of health ministry too has been attributed in the failure of these units, contributing to sluggish tests. The government had formed a high-level committee under the coordination of Deputy Prime Minister and Defence Minister Ishwar Pokhrel. The government had formed a high-level committee under the coordination of Deputy Prime Minister and Defence Minister Ishwar Pokhrel to avoid a possible outbreak of COVID-19. Each of the ministers in the committee has a separate subcommittee of their own. The government had also formed an emergency task center with 7 mechanisms to manage health materials and facilitate for tests. However, all these units have failed to meet the public expectations. Meanwhile, Health Minister Bhanubhakta Thakal and Secretary Yadav Koirala have failed to take a desired initiative, as they cite that the government has formed coronavirus-specific mechanisms. The Nepal Army that was entrusted with the task of procuring health kits a month ago too is yet to deliver the assignment. The number of tests through PCR method has been limited to around 300 per day despite the increasing available laboratories. As the number of infections have reached 54, there is a need to increase the parameters of testing. However, the government is yet to expedite tests. The lack of coordination and effective performance from the government and the committees formed to fight against COVID-19 is visible in the streets too, as the number of vehicles violating lockdown ruling has been increasing every day. The government has also been distributing vehicle passes in haphazard way, as the number of vehicles transporting people in and out of the capital has increased in recent days. The number of patients in private hospitals in the country has dropped significantly since the start of the ongoing lockdown. Private hospitals are therefore bracing for a financial crisis, as usual expenses have remained intact while hospitals have been recording depleted income. We have a report.
Almost all government and private hospitals across the country are operating amid the ongoing lockdown as health services come under emergency services. Hospital managements have continued with their daily schedule, and all regular doctors and medical staff are available like any other normal day for patients. However, many hospitals have been struggling financially as the numbers of patients have gone down. The restriction on transportation has been attributed as one of the reasons. Private hospitals report 80% of their daily operation has been affected due to the lockdown, and some have even reported of financial constraints.
कोभिड को मारले गर्दा जुन एउटा इलेक्टिभ सर्जरी ओपीडी सरकारले नै नचलाउनु भनेपछि हामी सबै मारमा परेर त्यो सुचारू रूपमा भइरहेको छैन र त्यो सञ्चालनमा आइरहेको छैन। इमर्जेन्सी सेवा चाहिने दीर्घ रोगहरू जस्तै डायबिटिज भयो, डायलिसिस भयो, यिनीहरू मात्र सेवामा आउँदाखेरि अस्पतालको आम्दानी पनि झर्ने अवस्था आउँछ। भनेपछि अस्पताल त दुवैतर्फबाट मारमा पर्छ, उता खर्च बढिरहेछ, आम्दानी घटिरहेछ र साथसाथै कोभिड-19 मा काम गर्न जुन हामीले स्वास्थ्यकर्मीहरूलाई प्रोत्साहन गर्नलाई उहाँहरूको तलब सुविधालाई पनि हामीले धेरै कटौती गर्न मिल्दैन। सरकारले गर्न सक्ने हेर्नुस् धेरै छ, भनेपछि पैसा मात्र दिने होइन, अनुदान मात्र दिने होइन, अरू कतिपय उपाय छ, त्यो उपाय दिएर अहिले यो अस्पताललाई निकाल्ने हो।
According to estimates, it takes around 100 to 150 million rupees to run a hospital with 15-bed capacity. As there are around 350 private hospitals registered with the Health Ministry, around 150 billion rupees have been invested in private hospitals in Nepal. The Association of Private Health Institution Nepal claims private hospitals have employed over 75,000 health staff who are now hard to afford amid the ongoing crisis across the country.
अरू सङ्घ संस्थाहरू चाहिँ अहिले जे भए पनि केही उनीहरूसँग इन्कम छैन, चुप्लाएर बसिरहनु भएको छ, खर्च त छैन नि, कमसेकम त हामी त खर्च पनि गरिरहेछौँ र तयारी अवस्थामा छन्, कुन बेला के हुन्छ भन्ने कुरा भयावह स्थिति भएको हुनाले हामी त एकदम तयारी अवस्थामा छौँ। त्यो भएर खर्च त एक्स्ट्रा भइ नै सकेको छ, यहाँ भइ नै रहेछ। त्यो कारणले गर्नाले हामीलाई चाहिँ त्यो स्थितिमा हामीलाई हेल्थलाई त्यो स्थितिमा राख्नु पर्यो कि ऊर्जा त्यसपछि पर्यटनको हाराहारीमा हामीलाई त्यो राहत प्याकेजमा हामीलाई सरकारले हामीलाई त्यस क्याटेगोरीमा राख्नुहुन्छ।
Many businesses and services, including private hospitals, have been reeling under the global coronavirus pandemic. This calls for the government to introduce relief packages and programs to ease the economic crisis.
Government's revenue collection from the Rupaidiya customs in Western District of Bankhe has declined by 3 times as imports and exports have gone down due to the ongoing nationwide lockdown. Customs officials say revenues from imports of vegetables, fruits and fuel have dropped significantly. The nationwide lockdown has been in effect since 24th of March last month to avoid coronavirus outbreak. Movements including export and imports from many border points have gone down ever since. The Rupaidiya customs in Bankhe district that on any given day had more than 50 freight vehicles entering hardly sees 20 vehicles these days.
पहिलाको भन्दा अलि कम छ र रासोको हिसाबले पनि कमी आएको छ किनभने कमर्शियल आइटमहरु टोटली आकै छैन भन्दा पनि हुन्छ.
Prior to the lockdown, the government had collected 999.8 million rupees in the preceding month. However, since the lockdown, the revenues have only exceeded 232.8 million.
इन्डिया साइडबाट पनि जुन अनुपातमा पहिला पठाइराखेको थियो फलफुल तरकारीहरु हैन त्यो अनुपातमा इन्डियातिर पनि आइराखेको छैन अहिले र यो कोरोनाकै संक्रमण हुन्छ भन्ने मान्छेलाई चाहिँ आभास भएको हुनाले चाहिँ कमी आएको हुन सक्छ.
Production and export of fruits and vegetables from India has been affected by the lockdown. However, the current situation can also be considered as an opportunity for the government to encourage and facilitate local production of agricultural goods to reduce trade deficit with any other nation, including India. A study by American Centers for Disease Control and Prevention has reported lockdown imposed by governments across the world has caused mental health problems in children. The research has been based on developed nations like China, Italy, Spain and the UK. However, the results can be relevant for children in Nepal as well. We have a report.
Over 1.29 billion school-going children in 186 countries are confined to their homes as countries have imposed strict lockdown amid the coronavirus pandemic. This means majority of the children and young adults have not met with their friends and socialization has been limited to electronic mediums. Many have been deprived of sports and recreational activities that play a key role in mental development, especially for growing children. A study carried out by American Centers for Disease Control and Prevention, CDC, has reported many children have been showing symptoms of depression due to the prolonged lockdown. Based on CDC's study, 23% children in China have begun showing mental health problems. The study was carried out among 3 to 17 years age group. Over 6 million children and young adults in the same age group are in similar situation in Nepal as the government has imposed a lockdown for over a month now. However, no research on their mental health conditions has been carried out yet. Most children are active and inquisitive by nature, which makes it crucial to provide them with platforms for interaction and learning environment. However, many children are compelled to stay engaged on mobile phones and televisions, which experts say has a direct impact on their mental health.
And it's time now for our segment Public Pulse, where you text us with your opinion.
Public Pulse.
And here's the question. What's your take on the lack of coordination among government committees formed to control coronavirus outbreak? Your options are option A, incapable leadership, option B, faulty mechanism, and option C, perverse attitude. The voting is on. Type NEWS, select your options A, B or C and send it to 34001 to share your opinion with us. And time now for the sports update.
Sports news.
FIFA's Medical Committee Chairman Michel de Hurg says he believes football should not resume until September at the earliest because of the coronavirus pandemic. De Hurg, speaking to Sky Sports, described the pandemic as the most dramatic situation lived in since the Second World War. UEFA has given European domestic leagues a May 25 deadline to provide details on if and how they can complete their seasons. France became the latest country yesterday to announce that the 2019-20 season is over, with no sporting events allowed until at least September. The Netherlands, Belgium and Argentina also have done so. La Liga president Xavier Tebas questioned the decision made by France to end their competitions early. And in view of the ongoing coronavirus pandemic, we have decided to drop our special segment Laugh Out Loud and replace it with a special package on COVID-19 instead.
Anxious Sydney surfers waited on the Bondi Beach promenade as the barriers came down on Tuesday and the iconic beach was officially reopened after the COVID-19 lockdown, allowing surfers and swimmers to exercise. Dozens of surfers strolled onto the sand and hit the water after the New South Wales government relaxed some restrictions, allowing several of Sydney's eastern suburbs' beaches to reopen. Australia has avoided the higher numbers of deaths as seen in other countries as the coronavirus ravages communities around the world. Australian states are starting to relax some restrictions as the local rate of new infections slows to barely 1% per day compared to 25% a month back.
It's really fun with the surf open because now we can exercise and do the stuff we love. And it's okay waves, but it's just fun to get in the water.
Restrictions have also been lifted in several states in the US as well, including Texas, resulting in crowded beaches. Georgia on Monday allowed restaurants across the state to offer dine-in service, easing the stay-at-home restrictions put in place to help fight the coronavirus pandemic. In a push to kickstart its battered economy, and despite warnings from health experts, Georgia joined a handful of states from Montana to Mississippi that are set to reopen businesses previously deemed to be non-essential. Business shutdowns to stem the spread of coronavirus have led to a record 26.5 million Americans filing for unemployment benefits since mid-March, with the Trump administration projecting that the jobless rate will likely hit 16% or more in the ongoing month of April. Elsewhere, Bolivia took its first steps at loosening strict quarantine by allowing restaurants to open for home deliveries and pickup. Bolivia has taken aggressive measures to slow the spread of the highly contagious disease, including a nationwide quarantine and closing the country's borders. As of Tuesday afternoon, Bolivia registered 1,014 cases of coronavirus with 53 deaths. In St. Luke's International Hospital in Tokyo, Japan, at any given time, 7 out of 8 beds in the intensive care unit are taken up by critically ill coronavirus patients. As the number of confirmed coronavirus cases in Japan tops 13,000, a veteran nurse said hospitals like St. Luke's are saving their limited ICU capacity for an increasing number of critically ill patients. With some hospitals reluctant to take in COVID-19 patients, the most critical cases are transferred to willing hospitals like St. Luke's, which are already inundated.
本当に限られたところだけで必死で受け入れてパツパツになって、いや手術じゃあやめます、その分患者さん取ります、検診やめます、病棟広げますって言って一生懸命一部の病院が取ってたわけですよ。そうは言っても患者さん増えるんで、限界があるわけですよ。
Although the Japanese government declared a nation
And those were our latest headlines. Stay with us for more news and entertainment on KTV HD. Have a good day and stay safe.